Welcome to Resolution Redefined, our little podcast here. Let me just begin by saying it is so cool to be speaking with you right now, because we were just talking about this before the interview that, we've been watching your videos since high school. I think I was in grade 10 when I started watching yours.
Yeah, and Hriday told me that that he was in contact with you, and then he showed me like your channel. I was like, wait, I've seen his videos for years now. And thank you again for.
No worries, guys. No worries. First of all, I want to say, Hriday, really awesome stash. Good stuff.
Thank you. Like, right back at you.
Addy will get you next year, buddy. So don't worry.
Yeah.
Where are you guys in terms of university? Are you first year, second year? Where are we at?
We're both in our third year of the neuroscience program here at UBC.
Awesome. Very cool. Are you liking it so far?
Great, we love it.
Yeah, it's really fun. That's how we met actually. Yeah, and then started this thing. But yeah,
very cool. How long have you been doing it for?
I think we're coming up on 6 months now, and we're a little slow on the editing process, but we're trying to get them out as soon as possible. So, yeah. Speaking of Movember, let's just start there because we kind of want to talk about why we started, our motivation and stuff like that. And I'll let you go first and talk about how you got involved in Movember, because that's how really this connection happened, and that's why we're here today.
Sure thing. Before I get into it, I just want to ask, because I just joined. Are we already being recorded right now?
Sure, we're good. Yeah.
Good. I'm glad I came on looking presentable then.
There you go.
So I've been doing Movember for 12 years now. This was year 12 for me, or possibly 13. When I started, I was in high school. And at the time, I didn't really know much about the charity at all, because the Movember charity actually started in like the 2000s. So I came on after it was already going for a few years. It started in Australia. And what had happened was I was this relatively scrawny little kid in high school. I was a little bit bigger when I was a kid, and then I was pretty scrawny in high school. So I joined the weightlifting club at school that was run by some of the teachers. And one taught religion, one taught English, one taught, I believe it was science. And they're all really big into the gym. And there was this really cool community of like camaraderie and helping each other out and pushing. And they were all doing Movember, and it turned into like this school campaign led by these teachers. And that was my first year. It was a ton of fun. They had some announcements on the PA system and a few guys in the gym walking around with a mustache. And I know not everyone could grow a mustache when they're 16 years old. I had no problem with it though. And then from there, throughout my career, have only gotten more involved. So I worked at Princess Margaret Hospital as a volunteer when I was in my undergrad, and that's when I really got more into the world of cancer and health. That was really my first exposure even before medicine. But really, it was a couple of years ago now where one of our friends died from suicide. And he was one of my best friends for a very long time, and just an awesome guy all around, like fantastic. Could not have asked for a better friend. And since then, the focus of my campaign for Movember has really transitioned to bringing people together, taking a little bit of my experiences from when I was 16 in this community aspect. And then we do a charity soccer game in my friend's honor every single year. And we just had the biggest turnout that we've ever had for this soccer game. So we're hoping that next year we could pitch it to the city that we all live in and see if they want to get involved and how we can make it even bigger.
That's incredible. I gotta say, I got involved because my first year of undergrad, I started volunteering as well, but I was at a crisis line. And at the crisis line, I had so many conversations with men and women, who were struggling with their mental health. And I'd been following you for a while, so I'd seen the Movember post for a few years at that point. And I was like, maybe I should be doing something as well. Last year, I was still like 18 at the time, so the stash wasn't too good. But this year, there's been a bit of an improvement there.
So
yes.
How does it work with the gym post that you post? Like, because I remember last year you were doing it every day, and then this time you're doing it like once in a while. How does that?
Well, you're calling me out here, but the challenge there.
You go every day. You said.
The challenge there is you can either grow a stash if you can, or you can move every day or run 60 kilometers or something like that. You can basically set your own challenge and use that to raise awareness. Last year I spammed too many people with those stories, and this year I'm just taking it down a little bit.
Well, the thing is, I love that Movember has come out with this ability for anyone to get involved, right? You can't grow a mustache, that's fine. There's other things that you could do, and I hate when people still think about it as like an all boys club. Like it is a charity primarily for men's health, but on our team there's many female members, and they do amazing. And yes, you could either choose to grow a mustache or you can mow your own way. So one of the things that we do on our team is a challenge that we set, which is to get into the gym every single day or do some sort of physical activity for like an hour a day, 45 minutes. For me, I missed now 2 days with these ICU shifts because when I'm on a 24-hour call, there's no gym at the hospital. So I'll probably be extending my campaign a little bit further just to make up for those workouts. But it's a ton of fun.
Very cool. Yeah, in fact, one of our teammates is someone who's in our major, Michelle. She is doing Movember as well with us.
Oh, really?
Yeah.
Michelle is awesome. Michelle, I've known Michelle for years now. Yeah, she's really cool.
Oh,
Absolutely.
Michelle from like our
major,
wow,
yeah.
Okay, yeah, full circle.
Yeah. Very cool. So real quick, if people are wondering where they can donate, where can they go?
Yeah, you could always, if you go to my Instagram, I have the link in the bio to our team, so you could choose to donate there if you'd like, or just get involved. Like if you have the funds to support us, that's amazing because a lot of good work comes out of the donations. But really, the reason why I choose to keep the mustache on for all month if I can, right, is to get the conversations going, right? And I think the best thing that you could do during this month is to find a couple of your friends, hang out with them more. Pick up 4 or 5 of you, go to the gym, do something that you wouldn't have done just for the sake of getting together, because I think that's probably one of the best interventions that we can make at a community level.
Absolutely. That's awesome. Yeah. Loneliness is this thing that doesn't get talked about often, but there are countries in Europe now that have ministers of loneliness because they're identifying this as a major public health issue.
Yeah. And you could look around the world, right? Like there are different ways that we choose to tackle different issues, right? So without going down the rabbit hole too much, yes, there are some countries where this is a bigger problem than in others, right? And a lot of it comes from the work culture, and it's not the same everywhere, right? Like even comparing Canada to the United States, on average, the Americans work a few more hours every single year than we do here. Now, my family back in Italy, and this is not all Italians, but there are still some places in Italy where work culture isn't as prevalent as it is here. So you're not working as many hours per day. And that does play into having a little bit more time for yourself to spend with your family and do the things that you enjoy. So it's all about, taking care of yourself and working within whatever system we can.
Right on. I want to transition a little bit here into talking about Health Frontiers Canada, a little nonprofit that we started.
Sure.
Really what led us to start that was the fact that we saw around us, especially here in BC, that wait times with healthcare had gotten terribly high. To the point that people weren't able to access the care in a manner that helped them recover quickly. And I know you have a very recent story.
Like even like 2 weeks ago, I was sick with some sort of infection, and then I wanted to see if I could get antibiotics or something. And the earliest I think appointment they had was like February or something, just to see a doctor. I'm not going to be sick by then, right? So
I was going to say that doesn't sound very helpful at all, right? It's a reality of the system, but it doesn't sound very helpful to me.
Yeah. So and I had to go back to Calgary, where I'm from, to see my regular family doctor because the wait times are much better there, at least. It's terrible.
Yeah. You made a really interesting video recently comparing the US and Canada system, and some of the stats you mentioned there were everything from ER wait times to seeing your family physician and elective procedures were significantly higher in Canada than they were in the States. And I'm wondering if you can speak to a little bit about that and what does that look like in terms of the quality of care patients receive?
Well, first of all, guys, I love that you're getting involved. I love that, we state all these like anecdotal observations. We'll talk about that in a second too. Whenever we have this talk, right, like it's always a nuanced conversation. Because I think when I put out like a 15-minute video on YouTube or like a 12-minute video on YouTube, I try and get as many points as is possible in that 12, but it's never the full story, right? One thing that I'll say is that in Canada, we have some of the most highly trained medical professionals anywhere. And that's from nursing to doctors. Like, just think about the process of even becoming a family doctor, where you're doing 4 years in undergrad, usually, 4 years in medical school, usually, and then a 2-year residency. That's the shortest way to do it. You could also go ahead and do 4-year undergrad, 2 year master's. I know some people even do a PhD before they're finally accepted into medical school. So really, I think that the doctors that we produce here and the healthcare staff that we have are top tier. And I think that there are, everyone is trying their best to see the people that we can. End of story. Now, one thing that I'll say is that really, thankfully, myself as a teenager and even younger, I didn't have many interactions with the medical system because I was a relatively healthy kid. And similar to you, Adi, every now and then would have to go see my family doctor to get some antibiotics or to do a blood test or immunization, right? Really, what I started to notice more and more started when I was volunteer at Princess Margaret Hospital, which is a top 5 cancer center. They do amazing work there. But depending on where you're living in the country or even in the province, like if you have family that live in Meaford, Ontario, trying to get into one of those cancer centers, hours drive away if you don't have a car. So the access is one really important thing. Physically getting there is very difficult. Okay. The second thing is, in the context of me recently trying to get involved with rural emerge more than I have in the past, this summer I worked in Wyerton, Ontario, which is by Owen Sound. And, being there for multiple shifts per week, you see that the wait times, 7 hours sometimes, 9 hours sometimes. You have one doctor working an entire hospital. And when you look at it in that light, comparing the Canadian to the American system, there are many negatives to the American system. I don't want to prop them up on a pedestal, but we have two very different healthcare systems. And when you have a patient that's sat in that emerge for 7 hours, and then you finally get to them, sometimes justifiably so, they are very hostile towards us. Mm-hmm. And you have to try your best to explain that, listen, we're all here working as hard as we can. Just the sheer volume of people, we can't move it along as much as we want to, right? And I will pass this off to you guys in a second. But recently, someone had left a video saying, do you think, one of the differences between the Canadian and the American system is the access to care? Do you think that maybe the wait times in the States are less because it is prohibitively expensive there? And I'll say most definitely that does play into the equation. I would think so. I would respond in saying that I was involved in a study looking at what's called high frequency use of the emergency departments. And what this did is that it looked in the Niagara region at people who were using the emergency room more so than usual. Now, if I passed it to you, if I said, what is high frequency use of the emergency department? How often do you think, on average, someone should be going to the emergency department per year?
On average?
Yeah. There's no right or wrong answer here. Just, curious.
Like one or less.
Well, I guess it depends on what you're going there for. If you have a family doctor, then a lot of those emergency room visits can just be avoided.
Yeah, exactly.
On the other hand, if you're just going for every antibiotic prescription or every blood test that you need, that's going to be maybe up to once a month.
Right. Yeah. And you are spot on with that. In a perfect system, everyone here would have a family doctor. You'd be able to get in to see your family doctor whenever you want. I could talk your ear off for about an hour as to why that's not happening right now, unfortunately. Family medicine is one of the highest demand specialties right now for medical professionals. But yes, even if we took a higher end of your estimates at 2 times per month, right? That's 24 visits per year. I will tell you that in our study, we identified people that are using the emergency room 100 times per year, 200 times per year, and in some cases, 300 times or more per year, including multiple visits to multiple emergency departments on the same day. Mm-hmm. Sometimes, and it's a very difficult conversation to have, when you make these services overly accessible, whereas you should be funding other things as well to help circumvent so that people don't have to go to the emergency, they could go in other places, and we could leave the emerge as a place for true emergencies. That's when you have this buildup, okay? And so you see very quickly how, it's hard to come up with a solution, but that's the system that we're in right now.
Right. I am curious about that. What do you think led us to this point? You said that you've got some points about why family doctors are so sparse right now.
Yeah. Let me ask you guys, you're in neuroscience, right? Okay. Don't even say for you. The pre-med circle in BC, which I was never a part of, I was here in Ontario. What does everyone want to be when they grow up? When you graduate from medical school, right? What are people saying that they want to do?
I think I've only ever met one person that said family.
Yeah, it is fairly rare.
It's fairly rare.
Yeah.
Yeah.
At
Here,
least
dermatology, radiology, and surgery a lot more often.
Yeah.
Exactly. I agree with you entirely. That's something that I've seen with the students that I work for too. And I think one of the biggest reasons why is because for many years now, we've done an amazing job at putting down the profession of family medicine, right? As identifying family medicine doctors as these people, they work in clinics, walk-in clinics, and you go see them, and there's not really too many awesome things you do. You fill out some paperwork and you go home at the end of the day. But really, family medicine is so much more than that. This is the true generalist specialty. And it's something that I'm incredibly proud to be a part of. I love the fact that I'm going to be myself doing rural emerge, full-time practice work, care of the elderly. Like there's all these awesome things that you could be doing. A lot of procedures done in my office, a lot of procedures done in rural emerge as well. And I just love that aspect of it. I love being able to never being able to truly let go of one particular medical system. You know what I mean? Like I'll never have to forget about treatment provided for heart failure, for example. Whereas if you did something else, a different specialty, dermatology, you're not treating a lot of people with heart failure, right? But the other thing too is, speaking to real family medicine doctors that have come before me and even now, there's a discrepancy in a few things: pay, hours worked, overhead costs, a few things like that. BC has recently come out and they've made some changes to the way that the family doctors have been paid. Personally, I think that is one of the biggest interventions that we could look into as far as pushing people into the specialty, right? Because on a personal level, you and I could sit down and have this conversation about how important it is to practice medicine and get involved in healthcare to support each other in the community. And that's exactly the motivation for it. But on an individual level, how do I get the brightest applicants and the most number of people possible into family medicine? There needs to be more in terms of incentivizing that specialty, especially when you compare to dermatology, surgery, or anything else.
I think I heard recently in Alberta, I can't speak to it much because I don't know it fully, but the whole, there's something with nurse practitioners being allowed in Alberta.
Not too familiar with that.
In the last few days. I don't know if you've heard anything about that.
Alberta is a little bit beyond where I look into for the most part from my own job. But what I will say is that what I think you might be touching on here is the concept of, some people have termed it scope creep and different. So here in Ontario, pharmacists could provide certain medications. If you go in with symptoms of a UTI or a few other conditions, they could prescribe you something. The nurses in certain situations here will also soon be able to prescribe medications like Wellbutrin, which is a type of medicine that we use in depression, for example, as well as a few others. So gradually you are having other specialties that are able to do some of the roles that have typically been thought of as reserved for the physician. Personally, I think that there are good and bad things about both sides of this argument, right? To our earlier conversation, there are areas in Canada with no doctors, zero, like none, okay? For example, there are fly-in opportunities for family doctors that want to go work rurally. You literally get on a plane, fly into a community in the middle of relatively nowhere here in Ontario, and you provide care for them, because when there's no one there, healthcare is provided entirely by whatever specialists they have there, nurses, nurse practitioners, whoever's there. If there's going to be no doctor there at all, you need to create a system where the people that are there can actually supply some of these evidence-based treatments, right? On the other hand, what we do know is that all, for the most part, you never really say all in medicine, but many of the medications that we use in medicine have side effects. Yeah. And you need to be very careful in terms of stewardship and making sure that the people that are giving out these medications are trained properly on some of the pros and cons of giving out the medication, right?
Absolutely. Yeah. And beyond family medicine, you spoke in that same video about the code gridlock being called in the ERs where there are no patient beds. That's clearly like a systemic failure. And you talked about how, that can range from like 20 hours to days. Whereas in the States, it's something like under 3 hours median. So talk about that. Like, how does that affect patient care when people are waiting for days in the ER?
Great question. And for this, okay, again, comparing to the States, right? Yes, there's that list that I put out that shows that the median averages. Mm-hmm. Looking into that, just I want to do my best part and say I am sure there are cases in the States too where code gridlock or their equivalent is called, where there's no hospital beds. I'm almost positive that does happen on occasion. However, what I've seen in my experience as a Canadian physician is that code gridlock and similar systems failures, as you've called them, where we don't have access to enough beds, is something that's relatively common, especially in certain times of the year, like right now, where we have influenza, COVID, a few other viruses going around, and people need access to the hospital. The Canadian population, if you look at our graph, continues to increase every single year. The amount of new hospitals, new hospital beds, new providers of care has not increased at the same rate to meet our growing population. And I don't necessarily have the answer. I'm not a politician, unfortunately, or maybe fortunately in this case. I don't really want to be a politician, but I will say that it is currently an issue that I think some people are currently looking into. I don't have the answers, but from me personally working, yeah, I think if you go to the emergency room enough, you will come across situations of not being able to find a bed. Right now, I'm on ICU, and I could tell you with certainty last night, there are people waiting in the emergency room post-code that need to be so they had cardiac arrest, and we did CPR and then the whole algorithm on them. And they're still down there in the emerge because we didn't have any beds on ICU. There's nowhere for the specialist to send them to unless that infrastructure exists. It's difficult.
Yeah, I'm wondering sort of, I understand you're not a politician. I don't want to force you to answer a question that you're not comfortable with, but what does it mean for that patient who, like, let's say that one you mentioned that was post-code and waiting in the ER? In terms of care, does that mean that they're not getting, the exact care that would be optimal for them?
As I said before, every doctor that's working in the hospital that I know is trying their best. They're trying every single situation. So what we're having then, the system is not optimal. Does it mean that people are not getting the standard of care? Absolutely not. I don't think so at all. I think that we are trying our best to use evidence-based medicine and making sure that people get the care that they deserve. However, having said that, if we transition the topic to elective surgeries, for example, and you want to make the argument that 6 months waiting for an elective procedure is not acceptable, I'm right there with you, right? I don't think that it's necessarily fair for someone to have decreased quality of life waiting for an elective procedure, a hip replacement, a knee replacement, something along those lines, and them not being able to get into the procedure just because it's not physically possible, right? So I will say in that regard, most definitely, I think many of my patients certainly feel like the system is failing.
Wow. Yeah, and that's another thing. Here in BC, we have a massive opiate crisis on our hands, and part of that is being fueled by people on wait lists in pain, whether that's for a hip replacement, a joint replacement, or something similar, or hernia repair, that just forces them to be in pain for months, and really that's heartbreaking to see. Yeah, but thanks for your response to that. Yeah, you were gonna say.
One of the hardest parts about family medicine, right? In the off chance that I was able to flip you both into thinking about it, right? Is that sometimes we can't help someone. And it sounds blunt, right? But I am very cautious of certain medical or medically adjacent or even pseudoscientific fields that promise people instant relief in one visit with their practitioner for 30 minutes at their office, right? Like you're not going to fix someone's depression in 30 minutes in a consultation. It goes a long way to getting people in there and talking to them, CBT therapy, antidepressants, supplementing and changing diet and increasing exercise. These are all things I strongly agree with. But the opioid crisis, as you know, is an incredibly difficult problem, right? And I think that we've done a great job in getting ourselves to where we are now in terms of not a good place. And I think the way that we slowly begin to move out of it is multifactorial and probably not even the most effective when you look at it flat on.
Very cool. I am thinking about family, but I don't want to make you feel like I'm not thinking about it at all. My favorite part about it is the fact that, you form these relationships with patients that last their entire lifetimes or your entire career. So that part is super attractive to me.
Yeah. And that's an amazing part of the job, right? Like, a couple of the little babies, some that I've actually been present at their delivery. And now those are going to be lifelong patients of mine, right? They'll all live me, but I'll get to see them for all the time that I'm working, right? Which is really, really awesome.
Very cool. You tell me about some interesting patient stories that you might have, if you can, like anonymously. Talk about some of the coolest shifts you've had. I'm curious about that.
I as you've touched on, saying specific things about specific people kind of difficult, right? I'll tell you about my favorite kind of experiences from the other side. So that's how I'll answer this, right? In the family medicine context, being able to see these two patients that I have in mind, one is a gentleman in his 50s, the other is his father, who's much older. He's in his 90s, and his father has relatively advanced dementia. And the relationship, seeing the son bring his father in, and this gentleman's dementia, because everyone's dementia, it progresses, it changes over time. He is currently at the stage where he is experiencing a lot of flashbacks and different points of his life, and he verbally acts them out sometimes. And him even recalling stories about his time being in the military when he's with us in clinic. And seeing his son and how they interact and like their amazing kind of connection that they have. You see things like this and you see, dad takes care of kid when they're young. And then how amazing is it later on to see son take care of father later on too. And, shout out to everyone doing that right now. It does really touch you as a doctor to see the good in people, right? Because I think medicine is a profession that lets you see a lot of the good in humanity and then a lot of the bad as well, right? Another story from this summer, not necessarily one of my favorites, but just one that I've talked about before as one of the craziest shifts I've ever had was working in rural emerge and being on for a 24-hour. And I think it was actually my first shift where the waiting room had built up to about an 8 or 9 hour wait. And I was running around that hospital seeing we had someone come in who had taken a chainsaw to their tibia while trying to cut down a tree, so trying to put them back together without orthopedic surgery there, and trying to set up that referral and getting them transferred out. And then also we had some people that were there with different mental health crises, and then we had some other people there. Someone had a STEMI that night, so all these major high acuity things going on, so that the waiting list had built up massively. And then as I'm in there taking care of this guy who took the chainsaw to his leg and I'm stapling him back up, I hear bang, like a gunshot, right? But you never think it's a gunshot, right? Like I thought it was a car or something until I poked my head out of the suture room and saw that it was in fact a gunshot. There was police in the emergency department. One of the patients that was in the emerge had lunged at an officer, taken his gun, they wrestled with it for a little bit, and he shot a hole in the wall, right? So that is a story. It's one of those things where I was so stressed out that night. Like, I don't think I've ever been in a situation where the stress has been higher. But in a weird way, I look back on that night favorably because no one got hurt. We were able to hold our own, and it was an amazing learning experience that I am so thankful that I had in residency when I had the support of an additional doctor. Then if I would have just been the only doctor working that night, would have been a totally different story for me, right? So it's quite the life, quite the job, and I stand by what I said on the channel before. For me personally, if not even family medicine, just to anyone looking at getting into medicine in general, I regret nothing. Hours are long, it's hard to get here, but for me, incredibly worth it.
That's incredible.
Yeah, and sometimes gunshots get in there too.
Right. Yes, especially in like here in Niagara, there is there's a little bit of a gun culture, right? Like legal gun ownership. So sometimes we have seen injuries for people handling firing arms, even at ranges and things, right? But I would imagine, especially in the downtown Toronto core, then we're talking about a different type of firearm injury, right? So one person assaulting another with a firearm. We don't really see too much of that here, thankfully, right? But you're entirely right.
Very cool. Before I let you go here, there's a book that sits in the back of your YouTube videos all the time. It's When Breath Becomes Air. It's one of my favorite books of all time. Tell me about that. Why do you keep it in the background?
Well, I'll tell you what. What did you think about the book?
Absolutely incredible. Read it, at a time in my life where I was kind of figuring out where I was going and trying to figure out if medicine was right for me. And I think it certainly helped me sort of realize what that life is like. And then again, like it's not about medicine itself. It's about how fragile life can be. And you can do everything right and sometimes you're just sort of swept off your feet by things that are completely outside of your control.
Right. Now, I'll say that that book was actually given to me as a gift by a student that was applying to medical school. And this was back when the channel first started, and we did a little bit of some like practice, like when you're going for interviews, you practice with a friend about answering some hypothetical questions that you find online somewhere, right? So I did like a half an hour kind of question and answer with her about some situations that we found on some forums and things like that. And she eventually ended up getting into medical school and gifted me the book as well. She said it was one of her favorites. And most people that have read the book describe it as one of their favorites, right? Personally, I love listening to reflections from people that have been in situations that I want to be, okay, or have done something that I aspire to do, to hear what it's actually like and to get their insights. Now, I won't spoil the book. It is a little bit, it's melancholy, right? There are some reflections in there. I think it's incredibly important to not avoid these melancholy lessons, but instead to read them and interpret them and let them sit with you, and let that change the way that you see the world and your job and a few other things. As anyone that's seen my channel knows, I try my best to advocate for taking care of yourself first so that you can take care of other people, right? And I think there are so many different experiences that I've had that have led me to that realization, and this is where we're at now.
Incredible. Thank you so much for your time on here. It's been incredible talking to you. I know if high school me would see us right now, would just be giggling.
Likewise, gentlemen. It's been a lot of fun. Okay, so thank you so much for having me on here. And I wish you all the best, seriously, because we need more people working. We need more good people working, and just the fact that you've taken this initiative to do something outside of your already busy schedules really speaks to your character, right? It's not easy. I know for a fact, and I'm sure you guys could tell me all kinds of stories about pre-med, right? But I wish you all the best, seriously.
Thank you, and likewise, thank you for creating this channel. I think it goes without saying, but it's changed so many lives, and I hope it continues to do that in the future.
Yeah, thank you.